manifestations under control or completely avoid them, completely heal the symptoms. So thereby the patient comes back to the normal. In the process of that, the expenditure which is made, how it should be minimized, how it must be reduced so that the patient will not feel much burden or the society should not feel much burden. That is economic outcomes. Humanistic outcomes. When we care the patients, obviously patients, because of that empathetic approach, they become more healthy. When they become healthy, you know, a wonderful humanistic relationship will be developed between us and the patients. The humanistic outcomes. See, these are the values, these are all the ultimate dividends of offering the professional services. What all that I said, it's all theoretical, probably, but international surveys which were conducted in US, UK, Australia tell that they are realistic, because always just now we talked about the economic outcomes, humanistic outcomes and the clinical outcomes. Yeah, that's what it is being proven by working, by doing studies. A study published by Michael J. Dooley, British Journal of Clinical Pharmacology, says that annualized cost savings related to the length of stay, readmission, drugs, medical procedures, laboratory monitoring as a result of clinical pharmacist initiated changes to the hospital patients management or therapy was almost, you know, this much money it is being saved. Like it is $4.4 million. Money is saved by the presence of the clinical pharmacists. A study showed that as the number of pharmacists involved in patient care rose in US hospitals, medication error rates decreased from an average of 700 per hospital per year to 245 per hospital per year. That indicates 65% of decreasing in the medication errors. Published in Pharmacotherapy. Direct participation of a pharmacist on patient care team significantly decreased pharmacy and hospital costs, as well as length of stay compared with minimal participation of a pharmacist. 78% fewer preventable adverse events occurred among patients in a hospital's general medicine unit when a pharmacist participated in a weekday medical rounds. Preventable adverse drug events in an ICU decreased by 66% when a pharmacist was present on rounds as a full member of the patient care team. Pharmacists providing pharmaceutical care in 1,000 US hospitals saved nearly 400 lives and $5.1 billion of public healthcare costs. Published in Pharmacotherapy. Patients treated with blood thinners in pharmacist managed anticoagulation clinic had fewer emergency room visits, fewer hospitalizations, and showed a total cost savings of $1,621 per patient. Pharmacist medication recommendations improved clinical outcomes in over 30% of cases at Veterans Administration Medical Center, saving more than $420,000 US. Outcomes in heart failure can be improved with a clinical pharmacist as a member of the multidisciplinary heart failure team. Hospitals save nearly $17 in benefits to patients for each $1 is invested in clinical pharmacy services. When I was undergoing a training, updating myself, especially in the clinical pharmacy specialty areas in University of North Carolina Hospital. It's a 350 bed teaching hospital, university hospital it is, university teaching hospital. They have a medical school attached to that. Of course, it's a wonderful campus. The director of pharmacy, who is also dean of the international affairs, the pharmacy services. So I should thank FIP Pharma Bridge program helping me to getting into that opportunity, undergo that training. So when I was having an casual chat with him, like, it's only 350 bedded hospital, but they have 35 clinical pharmacists. I was surprised. How you can manage so much of money you have to spend on them? Then very coolly said, every dollar I spend on the clinical pharmacists, I get a return of $20 saving to the hospital. That's it. That's a calculation. If we can prove to our government, I don't know how many clinical pharmacists are going to be appointed in various teaching hospitals across the country, and what will be the value for the PharmD program overnight, how it is going to shape up. So that is what is the aim now, which we have to look at in, and we, the teacher practitioners, should do the research investigations, because policymakers don't listen to your words, they only look at your numbers. So how much money we can save by these services to the government and to the society, then probably they will oblige having clinical pharmacists in government settings. Pharmacists providing services for HMO to patients saved almost $20 per prescription. Pharmacists providing pharmaceutical care to patients in an ambulatory care clinic save nearly $250,000 a month. So that way, there are so many studies published, the evidence of pharmaceutical care services, pharmacist services in terms of money saving. And FIP says 7-star pharmacists. Now it is our time. We have to look at. We have to change ourselves. First, being a good teacher, I must equip the knowledge, the skills, what I have to pass it on to my budding pharmacists, groom them so that they can become a wonderful professionals, be a good decision maker, excellent communicator, manager, keep myself abreast at every time, be a leader, and ultimately be a caregiver. So with this 7-star pharmacist concept, when we develop, whether we practice in the community setting, whether we practice in the hospital setting or clinical setting, yes, we definitely provide the patient care. What is now the need? Yeah, already professional responsibilities, it's already been given, which is approved, which is released by the Minister of Health. It is not that just only PC has drafted. It is approved by the Minister of Health, the pharmacy practice regulations, which came in 2015, 5 years passed, but hardly anything has happened. We still really do not have that feel, the pharmacists do not have that feel being to practice the pharmacy. We don't know what is professional dispensing. We don't know what is pharmaceutical care. We don't know what is patient counseling in the community setting. See, this is the time now to educate the pharmacists. Where are there in the community setting, in the hospital setting, in the clinical setting? Yeah, definitely we can make. So the PharmD program and B.Pharm pharmacy practice, another two wonderful instruments given by the Pharmacy Council of India. It's people, we always look at it, because even in my school, the PharmD graduate, the moment they completed the program, the question is, what job I'm getting? They don't question themselves what knowledge I have, how much I can deliver in case if an opportunity is given. If they start that kind of thinking, definitely opportunities are plenty. Community setting itself, the opportunities are there. I recently had a discussion with the AIOCD president. He said, yes, we can definitely incorporate the PharmD people in community setting if they are ready for that. To start with, he is ready to pay 25,000 rupees as a starting pay packet. It's wonderful. It's a right opportunity to start with. Go to the public. Though there we have to show our professional skill, convince them, then yes, changes will definitely come. Friends, I think with this long hour discussion, I just want you to understand Healthcare challenges are increasing. Different kinds of the clinical challenges, more number of medicines, understand the more about the medicine, application part of the medicine in the clinical situation. And we, the pharmaceutical care providers, should offer the solution to the patients. And it is very essential to empower the pharmacists as the professionals, because many times, I do not know, we have done a lot of studies. Majority people, they don't still consider I'm a professional. As long as that kind of negative feel is there, we can't change. It is individuals, they have to obviously feel, yes, I'm a healthcare professional. Definitely there will be a wonderful change, automatically starts within. Then it's a time for the implementation of the pharmacy practice regulations, making all the pharmacists through the state pharmacy councils to undergo the continuing education programs, update their knowledge and skills. And then, we have done so many such kind of the programs while I was at JSS, going through the Karnataka State Pharmacy Council and the Kerala State Pharmacy, even Maharashtra State Pharmacy Council. We have done hundreds of continuing professional development programs and empowered so many pharmacists. And many pharmacists, I am very happy. Some of the pharmacists whom I have trained in Mumbai, they started their own, health screening services programs in their pharmacies, like checking the BP, sugar. Then some of them, even the nebulization services they offer. That's wonderful change. And the pulmonologists used to refer their patients in emergency, please go there and get the nebulization done. Once we do all these, definitely we will become the 7-star pharmacist. So friends, my sincere appeal to all the teachers who are on this board and the policymakers and even the student friends, please just introspect yourself. How much I'm able to do it? How much I'm able to be close to the patients? How much I'm able to close to my consultants? Your answers will be there very much, and automatically the change will start from that point of the time. Thank you very much for giving this greatest opportunity, and my sincere thanks to the SRMC administration, especially the Vice Chancellor and Principal Dr. Ciddi Veeresham Garu, and then the HOD Dr. Seenivasan, and other professional colleagues who are on this meet. I'll be very much thankful to everybody, including my beloved the delegates, the students who are there in this. Thank you very much. Have a wonderful day.
Thank you so much for your informative speech, sir. Many participants have same question, sir. Can you throw light on current role of PharmD in India?
Current role of the PharmD
in India. Any participant ask the same question, sir.
Yeah, everybody will ask same question because they don't know what is PharmD first of all. That's a big challenge. That's what is I always look at. Because see, whether it is right to say on this platform or not, I have, like, as a inspector, whenever I visited the pharmacy schools, especially PharmD students, when I talk to them, majority of the students, they just were given an understanding that you can practice as like a doctor. The prefix, majority students who joined the PharmD program for that doctor prefix, because they could not able to get into the medicine, and then somehow they jumped into the pharmacy. But I don't say they have made a mistake. So there is so much opportunity which they can definitely improvise their knowledge and skill, especially in the pharmacotherapeutics, and they should start initiating the dialogue with their consultants while they were at the school, while they were at the wards. All ward activity simply will be done in absence of the doctor. Somebody will say, you go and collect the case records, get the case records, write the case records, write your pharmacotherapeutic records, and some examination, obviously university examination is conducted, and yes, internal, external, take one case and give, yeah, come on, you discuss. No, no, this does not make them professionals. I honestly say, I'm very sorry to say, it is not their mistake. It is not at all the students' mistake. If at all, if I am not teaching the way they should learn that concept, honestly, I take the responsibility is my mistake, because I'm not taking them to the ward at the bedside, show them the case record, show them what is written as a demography, or the complaints, what the patient has explained, and what laboratory investigations done, and then what is the therapy given, why this therapy is given, what are the regulatory issues in this prescription. Probably it is my responsibility to train my students. If I do it, obviously the students will do definitely better, because they are much more talented. I've seen that kind of the students also. They are really gems, because majority students, they come from this common entrance test examination, so they obviously they have the knowledge. So only thing is the guidance is proper there. So if we can do it, definitely they do much better activity. Now question is, how, what kind of jobs we have? This question is also piercing me and pricking me, like how, what kind of jobs we have to offer to the PharmD graduates. When I just gave a thought, majority hospitals, especially only the NABH or JAC accredited hospitals, somehow they are encouraging the clinical pharmacists to be there in their hospitals. This is one side of the segment. So how many of them are there? Say early around 500 or 600 hospitals across India. Probably they take one or two people. So at the most 1,000 people can be absorbed. So what about the remaining graduates? Where they should go? That's how I thought and gave a. I initiated a dialogue with the AOCD, that is All India Organization for Chemists and Druggists, because that is the biggest body, maybe a trader body, but even then the president is a professional, he is a pharmacist by himself. So when I approached, when I shared my thought, he said immediately you just send me 10 CVs, and he asked me how much salary you think it is more worth to give to these people. He said around 35,000 rupees we can start, because in Maharashtra a diploma fellow himself is getting around 25,000 rupees. Why not a doctorate by practice should get more than that? Then he said, okay, now I can start with around 25,000. If I'm happy with their services within 6 months, whatever that figure you have said, I'll just go to that. So I have in fact done a preliminary screening of around 20 applications, and then we sent few applications whom they felt, yes, we would like to work in the community setting, them to the AOCD. It's unfortunate now because of this COVID, though it is an opportunity, but unfortunate thing is people don't want to go anywhere around and work. See, this is the big challenge. So, but it's an opportunity that healthcare system is open, and you can definitely get that opportunity. So that's why he said, okay, let this August month pass, then we will definitely take a call on that, and we'll definitely recruit at least 10 pharmacists as a pilot. It's as a pilot in Mumbai itself. So once I go through their performance in next 6 months, definitely we will try to appoint more and more PharmD people in the community pharmacies, very good community pharmacies, where they can feel, yes, we are happy working in this place. So once again, you have to deliver yourself as a counselor, or as a health screening provider, or you can talk to them, you can analyze the prescriptions, you should be able to communicate to the doctors. Say these kind of the services. When, of course, Mr. Shinde, the president, also said, yes, we will sit one day and we'll discuss what the job responsibility of such pharmacists. So once that comes, definitely pan India, 10 lakh pharmacies are there. Pan India, 10 lakh pharmacies. Even if I just take 1% of that, I think probably we can definitely get our fellows get employed in the pharmacies and get closer to the public. So this is what is another approach I thought. I'm working on that area. How much I'll become successful once again depends upon the opportunities given by the AOCD and the people who are showing interest. Because so I give an opportunity to them, and they get appointed there, and after a month, no, 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 I don't like working here, I'll just skip off. Then obviously the objective will be failed. Where you have to be tight, sit there, yes, let me show my talents, let me prove myself. Once if one fellow proves, next 10 fellows will get an opportunity. That is what is the statistics. So my friends who are on this board, who are listening to me, think in that direction. Definitely opportunities are plenty. Never ever say government is not providing the jobs, government is not doing that, is not doing that. Yeah, and government definitely will do, but they want statistics. What is that you are doing? Where is your number? In the sense, number in the sense, not in your number of pharmacists. It is what you have added value, how much money you have saved, how many patients' lives you have saved, how much care you have given. See, this is the statistics. If we can provide to the policymakers, definitely policymakers will listen to us, and definitely a day will come, clinical pharmacists positions will be created in the government settings, and definitely the opportunities will definitely come up, and with the good designations will come. Definitely, Dr. Suresh sir is working in towards the direction. It is not that he's only a regulating body. Yeah, without the effort of sir, we could have not got this pharmacy practice regulations, because that is the legalization. You are showing the government itself is approved. These are all the responsibilities. So a person having these kind of the things, obviously government has to accept it, but you have to have our evidences, the statistic to show the government, then things will definitely come in our favor. This is what is my what I can say. I look at it in this direction, probably with a positive note.
Thank you once again, sir, for clarification of current role of Form D. I hope most of students accept your answer, sir. Now we move on to technical session 2.
Thank you very much, Seenivasan.
Thank you. Yes, sir. Thank you, sir. Thank you.
Okay, I'll close my presentations so that he can get to that opportunity. Yep, I'm stop sharing. Yep, now it is. Thank you.
Now we move on to, yes, sir. Thank you, sir. Thank you. Now we move on to technical session 2. Session 2 speaker will be introduced by Dr. N. Vanida Rani, Assistant Professor, Department of Pharmacy Practice. So over to Vanida Rani.
Good morning, everyone. Hello.
Good morning, madam.
Good morning, everyone. Morning, Krishna. Being grateful for the pleasant task of introducing my fellow professional, Dr. Krishna Undela, the speaker of the next session. He's about to deliver on the topic how to become a specialty clinical pharmacy practitioner, opportunities in India and abroad. Here, I'm about to introduce Dr. Krishna. Presently, he is designated as an assistant professor in the Department of Pharmacy Practice, Naipur, Guwahati. Krishna has graduated in pharmacy from Sri Vidyaniketan College of Pharmacy, Tirupati in 2010 and completed his MPharm in pharmacy practice from the National Institute of Pharmaceutical Education and Research, Mohali in 2012. He started his career at JSS College of Pharmacy, Mysuru as a lecturer in the Department of Pharmacy Practice. He completed his PhD in August 2019 from the same institution, and his research was entitled as Impact of Medical Education and Medical Conditions and Medication Use During Pregnancy on Adverse Birth Outcomes, a hospital-based case control study. He is an instructor for pharmacoepidemiology, pharmacoeconomics, pharmacovigilance, and pharmacotherapeutics for PharmD and postgraduate students. Krishna has having an experience in conducting various pharmacoepidemiological studies in hospital and community settings. He has received travel grants from International Society for Pharmacoepidemiology to attend conferences held at various countries, like to mention a few, in Hong Kong, Taiwan, Thailand, as a delegate, and also he has served as an educational session speaker in Australia. Australia, China, and Japan. Actually, I went along with Krishna to Japan last year, so I just witnessed his speech in person. So he has also received a travel grant from the International Society for Pharmacoeconomics and Outcomes Research to attend the European Congress in Austria in 2016. He had received an Endeavour Executive Fellowship in the year 2015 from the Department of Education, Australian government, to undertake 3 months training on the area of advanced pharmacoepidemiology and quality use of medicines at the University of South Australia, Adelaide, Australia. Krishna is also having a rich expertise in conducting systematic reviews and meta-analysis, and he has published papers in various peer-reviewed reputed journals, which are cited well. He presented one of his meta-analysis papers on statin use and risk of Parkinson's disease at 20th World Congress on Parkinson's disease and related disorders held at Geneva, Switzerland in 2013 December. Currently, he has, to his credit, 50 scientific publications, and his citations are 700 plus with an H-index of 9 and item index of 9. Krishna has delivered more than 70 guest lectures at various national and international conferences in the area of pharmacoepidemiology, pharmacovigilance, pharmacoeconomics, and systematic review and meta-analysis. Dr. Krishna Undela currently is a member of International Society of Pharmacovigilance, International Society of Pharmacoepidemiology, International Society for Pharmacoeconomics and Outcomes Research, and he is also a member of Indian Pharmaceutical Association. Friends, I present Dr. Krishna with great pleasure to our gathering. Krishna, over to you.
Thank you, ma'am. Thank you so much. Good morning, everyone. Thank you, ma'am, for the kind introduction and going through the entire profile. I'm glad for that. And I was very happy when I got a message from Rajanandh sir that all of our staff are unanimously selected you as a speaker for this conference. So I was very happy for that. Thank you very much for giving me this opportunity, and to respected Vice Chancellor sir of this Sri Ramachandra Institute of Higher Education Research, and Principal sir, and HOD sir, and Rajanandh sir, Vanita ma'am, and especially Dr. Adepu Ramesh sir, my mentor from the start when I started my career at JSS College of Pharmacy, Mysore. So thank you very much, all of you, for giving me this opportunity. And it's a great pleasure for me to speak along with Ramesh sir on one of the important issue, the specialty pharmacy. It's an upcoming one. Don't bother maybe when we say something which is advanced. It is not that you need to take it up right away tomorrow. It's a future. We are going to be show you some future aspects so that you can have a clarity if you want to do something in future in the specialty area. So there are many options. So our intention for today's webinar is to show you some of the future pathways where you can have some understanding so that you can take up all those things once you get it in the future. So with that introduction, maybe I'll share my screen so that we can go ahead with the presentation. Ma'am, can you see my screen?
Yes, sir. Yes, sir.
Sir, yes, sir.
Yes, sir.
Yeah. Thank you, ma'am. So the topic given for me for this webinar is how to become a specialty clinical pharmacy practitioner, and what are the opportunities we are having in India as well as in abroad. So this is the next level concept. I feel, especially the PharmD student joined here for today's webinar. You may be feeling that for PharmD itself, there are not many opportunities. So what I'm going to do after pursuing even the specialty clinical pharmacy. So once again, I'm mentioning here, and I'm quoting once again Dr. Adepu Ramesh sir. He rightly mentioned there are no opportunities in the sense. I think it is not. We are not searching for the opportunities. There are many opportunities, and the scenario got changed a lot in the last 10 years, especially for PharmD. Earlier, I think PharmD graduates used to think that in all advertisement they used to mention only B pharmacy and M pharmacy. There is no PharmD mention at all. I think now the scenario got changed. Now M-Pharm students are thinking in every advertisement there is a PharmD, so there is no M pharmacy. So what we need to do? I think this scenario got changed. So you don't need to feel still that you're not having the opportunities. I'll show you maybe some of the opportunities, what you can do after graduating from PharmD, and especially if you want to pursue further and be a specialty clinical pharmacist. There are various opportunities. So I'll discuss with those maybe, and then you can think upon which one you can take it up once you graduate from PharmD. And I think Adepu sir already explained about various clinical pharmacy services and the different types of pharmacists we are going to have. Hope all of you may be knowing the three main important types of pharmacists we are going to be see on regular basis. Like we are going to have a community pharmacist, a hospital pharmacist, and now we have a concept called a clinical pharmacy, the clinical pharmacist. And all of you may be knowing the different designations as well as their roles and responsibilities in their area, right? Like how the community pharmacist is doing and what the clinical pharmacist is doing and what the hospital pharmacist is doing in the hospital. I think all of you may be knowing very clearly their roles and designations. So today we'll mainly focus on the clinical pharmacy because we want to check what are the other opportunities the PharmD graduates are having apart from joining as a clinical pharmacist in the hospital. And before going to that, if you see the definition of the clinical pharmacy, which is given by one of the reputed organization or association, which is mainly meant for the clinical pharmacy, that is ACCP, American College of Clinical Pharmacy. They gave a clear-cut definition for this clinical pharmacy. It's an unbridged definition. Even I have seen the first time that unbridged terminology. When I saw what is the meaning of that, it's a complete definition. The unbridged is a complete definition of a clinical pharmacy. So clinical pharmacy is a health science discipline, as we know that, and in which the pharmacist is going to be providing patient care. And that is mainly meant for optimizing the medication therapy and promotes health, wellness, and disease prevention. So that's a complete definition. I think by going by the definition, you can understand this, but without definition also, you know what the clinical pharmacist can do in the hospital. So they're going to be work along with other healthcare professionals like physician, nurse, and other healthcare professionals. And maybe they're going to be working the wards. So why they're working along with the other healthcare professionals? The main purpose, the main reason behind that is to improve the patient care. Okay, so the ultimate goal of the clinical pharmacy is going to be improve the patient care, especially in the hospital setup. And there is no restriction that they should not work in the community. They can also work in the community. And the main goal is going to be improve the patient care, right? Like improving the promotes the patient health and improving their wellness and disease prevention. I think all these things maybe we can say in three different outcomes, as Ramesh sir mentioned. Like the pharmacist is going to be strive mainly to improve the three important outcomes: the clinical outcomes, economic outcomes, and the humanistic outcomes, right? So clinical pharmacists can certainly improve all the three types of outcomes by working in collaboration with all other healthcare professionals. So that's what this definition meant for. And all of you may be knowing what may be the qualification for this clinical pharmacist. India, as we know that M.Pharm pharmacy practice, that was starting in India in 1990s, where the first time M.Pharm pharmacy practice was started at JSS College of Pharmacy in Mysore and Ooty. And that's the basic qualification to be as a clinical pharmacist in the hospital. And after introducing PharmD in 2008 in India, now the PharmD graduates are also eligible to work as clinical pharmacists in the hospitals. And if you see the other countries, USA, you may be knowing that there is no M pharmacy and B pharmacy at, there is no concept of B pharmacy and M pharmacy there. So mostly majority is going to be the PharmD, where the PharmD graduates are eligible to work as a clinical pharmacist after getting their NAPLEX clearance. That is a North American pharmacy licensure examination. So they need to complete that before going to work as a clinical pharmacist. In Australia, once again, there is an M.Pharm concept where the M.Pharm students who done their graduation in clinical pharmacy, they can work as a clinical pharmacist. And like that, various other countries, like in UK, we have an MSc in clinical pharmacy, where the graduates can work as a clinical pharmacist. So there are various other qualifications, but mostly it is going to be either PharmD or M.Pharm or MS in clinical pharmacy. Those are mainly eligible for working as a clinical pharmacist. I think all of you may be knowing that already. And Sir also detailed about various roles and responsibilities of a clinical pharmacist. I think if you want to segregate the different roles of a clinical pharmacist mainly into three types, the patient-specific services that are going to be provided, those are mainly meant for improving the patient care. And the clinical pharmacist will be involved in facility-specific services where they can do something for the hospital or the organization where they're working. And also they can do some global services for the benefit of the clinical pharmacy community, right? So if you see the patient-specific services, they can provide various lots of services in the hospital overall for improving the patient care, where they can do the patient education and check for the drug interactions. Drug therapy monitoring is a very important one, and they can identify the medication-related problems and try to improve the patient care. And drug and disease management, pharmacogenetics, drug information services, drug and as well as poison information services, They can also do some pharmacokinetic and pharmacodynamic studies in the hospitals, once again, to decide the dose of the medication, as well as a collaborative practice agreements. So they can collaborate with other healthcare professionals to do or to improve the patient outcomes. And also they can provide some facility-specific services where they can do something for the hospital itself. As a clinical pharmacist, I think they will be mainly involved in developing the protocols, guidelines, and policies for the hospital, so where they can maintain in the hospital for the benefit of the patients. And certainly they can be involved in the research. I think you can see that maybe after the PharmD students are going to the hospitals, you may be realizing that the research work gone very high. I think earlier the research in the hospitals was only maybe the clinical trials which were going on. But after the PharmD students joined to the hospital, now I think most of the clinicians are depending upon the PharmD students for any kind of research, what they want to do in the hospital. And certainly there is an improvement in the research area after the PharmD student joining in the hospitals. And the core measures and quality improvement initiatives, they can take it up. Quality improvement initiatives, maybe they can come out with some of the guidelines or maybe audits they can do in the hospital where they can improve the quality of the services providing by the hospitals. And also, as you know, the pharmacist is the main person who will be involved in the formulary management, the formulary preparation, as well as management in the hospital, especially in the tertiary care hospital. And also they can do something for the medication safety. And by procuring the quality medications, they can be involved in the medication safety as well as in the facility-specific services. And globally, they can do something. As a clinical pharmacist, they can contribute to the society as well globally in terms of governmental and societal committees, and they can be part of some of the agencies, especially like ACCP, American College of Clinical Pharmacy. Though the pharmacist can be part of this association to do something for the clinical pharmacists who are there around the world. And also they can come out with societal guidelines and policy development and legal consultation, public health initiatives. So these are the various other activities the clinical pharmacist can perform globally and for improving the services by the clinical pharmacist. So I think this one slide maybe give you some clarity what kind of services can be provided by the clinical pharmacist and what exactly the meaning of the clinical pharmacy. So there's a basic clinical pharmacy I think everyone will do after graduating from PharmD or M.Pharm pharmacy practice. They're going to be joined as a clinical pharmacist. And when they join as a clinical pharmacist in the hospital, it is going to be decided by the hospital maybe where this clinical pharmacist is going to be posted. Because in the PharmD, especially in the internship, they are going to be undergo various rotations in various departments, especially in the medicine. Apart from that, they can undergo 3 specialty rotations as well, even though they are having a complete understanding on all the rotations. But once you join in the hospital, I think it is going to be decided by the hospital where they are going to be posted. Obviously, the one clinical pharmacist cannot be there in entire hospital in all the departments. So they need to be posted them in one particular area where there is a more kind of services required by the clinical pharmacist, right? So what is going to be happen? You may not have your own area when you join as a clinical pharmacist immediately after your PharmD, because you are not having your area. You are a general PharmD graduate and you may be having understanding of all the different areas which are there in the hospital, and wherever the hospital posts you, you need to go and work there. You don't have your specific area to work immediately after the PharmD or maybe immediately after the M.Pharm pharmacy practice. So with this today's talk, what we need to explain to you is even after PharmD, you can create your own area. By doing some specialization, you can have your own area that is based on your interest. If you're interested in cardiology, you can be a cardiology pharmacist. If you're interested maybe in pediatrics, you can be a pediatric pharmacist. So that's what is called a specialty. So we want to bring that component today through this webinar. It is not that only the clinical pharmacist is important. As a clinical pharmacist, you cannot work in all the departments of the hospital. You need to have your special area of interest, and in that area, maybe you can prove yourself and you can go ahead in that area. So that's what our intention for today's webinar on the specialty pharmacy. So I did not get any exact definition like a clinical pharmacy. I did not get any exact definition for specialty clinical pharmacy. But what I understood from the literature, the specialty clinical pharmacy means where the pharmacists participate in the management of specific medications or the individual disease states. That means they are going to be specific for one particular area or maybe one particular medical condition, or maybe particular for specific medications, may not be for all the medications. And they're going to be have once again in collaboration with other healthcare team. So as you know that in medicine, they have various specialties. Okay, it is not the doctors are going to be treat all the patients, except they are the general physician. They're going to be treat maybe all other general conditions. As you know, there may be a dermatologist, there may be a nephrologist, psychiatrist. So specialties are there in the physicians. And similarly, even in the pharmacy, especially in the clinical pharmacy. So in future, we are going to have a specialty clinical pharmacist where they're going to be working a specialty area, like maybe they're going to be working infectious diseases. They're going to be work maybe in emergency department. So they're going to be specialized in that area, and they're going to be work especially in that area to get and along with other healthcare professionals for the benefit of the patients admitting into that specialty area, right? So the goal of clinical pharmacist, the specialty clinical pharmacist especially, is going to be the broader, and it's going to be provide some comprehensive medication management. So they're going to be provide all the services only to that particular specialty area. And the specialty pharmacists are going to be bring unique expertise and value to healthcare system, because by studying further, even after PharmD, having the specialty. So having the specialty in the sense, it is not that simply they're going to get the specialty. Either they need to study further after PharmD, or they need to get some expertise in one particular area. By working as a clinical pharmacist, one particular area, maybe for 2 years or 3 years, they're going to get the expertise. And with that expertise, they can be called as a specialty clinical pharmacist, right? So with that extra additional qualification, or maybe the experience what they're going to be gaining as a clinical pharmacist, so they can provide some unique expertise skills. They're going to be gain some skills and knowledge in that particular area, and that's why they're going to be called them as a specialty pharmacist. And they're going to be have some unique expertise, and they're going to be have some value in the healthcare system. And this is similar, as I mentioned, no, whatever the specialties we're going to be gaining after PharmD, it is going to be similar to the medical specialties. So in medicine, many specialties, after MBBS, 6 years MBBS, a person can choose MD in a specialty, and they can pursue further for 2 years or 3 years, and then they can get an expertise in that particular area. So further, they can going to be treat the patients only for that particular specialty, right? So similarly, in a pharmacy also, we are going to be get the concept of a specialty clinical pharmacist. So where they're going to be work in a specialty area rather than as a general. If you want to see an examples like what kind of specialties the people are going to be have, I think these are some of the important examples maybe you can see, where we have a society of infectious diseases pharmacists. So already there are societies. I think we are lagging behind in India because we recently introduced a concept of PharmD. That's the reason we are still in the stage of clinical pharmacy only. I think we are not yet gone into the specialty pharmacy. But outside, especially in USA, the specialty concept is very much there. And with that specialty concept, already there are some societies, already there are some associations are with those specialty clinical pharmacists. I think this is one of the best example for that, where there's a society of infectious disease pharmacists. And you can see here, there's a critical care pharmacist, where the pharmacist is going to be work only in the emergency departments of a hospital as a specialty, a clinical pharmacist. So like that, there are various specialties. Maybe you can get to know in my future slides. There are already existing specialty clinical pharmacists are there in other parts of the world, and maybe that scenario can come soon in India also, so that you can gain those understandings. So looking after what are the opportunities we are having after doing PharmD 6 years course, what are the opportunities are there for you to get an advanced knowledge on a particular specialty and to become a specialty clinical pharmacist, right? So that's what we are going to be discussed today. After PharmD, what are the opportunities we have to become a specialty clinical pharmacist in one particular area that is of your interest, right? So I think first of all, I need to mention about one of the first initiation by JSS Academy of Higher Education Research, by introducing this residency program in clinical pharmacy. That is after PharmD 6 years course, they introduced a residency program to do a specialty course. Currently, they're having 2 areas. Initially, they started with oncology, and now they're having one more branch that is nephrology. And I think in future, they are coming out with more other areas, specialty areas, where the PharmD graduate can be doing a residency program to get a specialty, right? So that's the first initiation started by JSS Academy. In 2016, they started with oncology, and now this from current academic year, they're having from nephrology. And in future, they will get psychiatry and all other, they are planning for that, getting a clinical pharmacy residency program. And the aim of this clinical pharmacy residency program was to provide an education and training with a primary emphasis on the development of practice skills in specialized pharmacy practice area. So as a PharmD, you are a general, and if you want to become a specialty clinical pharmacy practitioner, certainly you need to have a training. Without that, we cannot get a specialty. So with that aim, they introduced residency programs in India to bring the students as a specialty clinical pharmacist and specialized pharmacy practice area. And the eligibility, if you see, of course, it is going to be the PharmD. I think now MPharm students, they need to think if they want to do a residency in oncology or nephrology. As such, in the regulations, it's mentioned PharmD, but I'm not sure either they're going to be take M-Pharmacy students as well, M-Pharm pharmacy practice students as well. So at present, the eligibility is a PharmD degree. So whoever is having the PharmD degree from the approved colleges by the PCI, and who are having minimum aggregate marks of 60% at least in the 5 years of PharmD course, excluding the internship period, if they have 60% marks, as well as they should be registered as a pharmacist in the respective state pharmacy council. So that's a minimum criteria to join as a resident in any one of these courses at JSS Academy currently. And the duration, if you see, it's going to be for the 2 years program, 24 months program, where it is divided mainly into 2 years. That's called RPY1 and RPY2. The RPY1 is a residency program year 1, where you're going to have 12 months of generalized training. So 12 months of generalized training is going to be mainly like an internship, like how the PharmD students are doing the internship. Similar fashion, they're going to be do generalized training in the first 1 year. And I think apart from maybe internship, they may expose to a very less number of specialties. But here in the residency program, they're going to have an experience in other specialties, which they did not get at opportunity to exposure during their PharmD course. That's what they can undergo in the first 1 year as a generalized training. And the second year is going to be completely on the specialty clinical pharmacy practice. For example, if they take a residency program in oncology, so completely they're going to get an oncology training in one of the oncology hospital in Mysore. And similarly, if they take nephrology, they will undergo 12 months complete training and in the nephrology area. I think that's going to be in the JSS hospital itself. So they're going to get the complete training on the specialty area for 12 complete months to get an expertise in that particular area. I think that's not going to be happen in the PharmD. In the PharmD, it is not possible for any student to go for a one complete internship, that is 12 months in one particular specialty. Not possible. You need to undergo medicine for 6 months, and you need to undergo 3 other specialties for 2 months. So you will not get enough time to get expertise in one particular area during PharmD. And that's the reason they brought this concept of residency program, where you can get an expertise in one particular area, so that in future you can become a specialty clinical pharmacist of an oncology, of a nephrology, of a psychiatry. So you can go and work in that particular department of a hospital as a specialty clinical pharmacist. So they're going to be provided in this period of 2 years, they're going to provide you 15,000 rupees per month as a stipend. Of course, you need to pay the fees for this for 2 years. And within that, maybe you're going to get the stipend as well for for entire 2 years program, what you're going to be studying at JSS. So that's about the residency program. If you are willing, maybe you can join as a resident student at JSS Academy. And the only difficulty here at present is in each branch, I think currently they're having only 2 students. So only 2 seats are available in each branch. So only 2 students can be eligible to be studied in each branch of oncology, nephrology currently. Maybe in future, based on the demand and requirement, they may increase the number of seats in the future. So I think that's one of the important area we can focus, one of the important, maybe the opportunity you are having in India itself, if you want to become a specialty clinical pharmacist, right? And the second one is going to be after, I think it is, I cannot say they copied, but it is after introducing residency program by JSS. And we have seen even the fellowship which is coming out on oncology pharmacy, and which is given by one of the reputed, renowned cancer hospital and oncology hospital, HCC. And they come out with a program called Fellowship in Oncology Pharmacy. I think it's almost similar to the residency program offering by the JSS. And if you see here, It's once again, the duration is going to be 2 years, and where they can, in that 2 years, they're going to have the internship. That means internship here it is, so the second year is going to be the internship for them under the residency program. And the eligibility here, once again, the PharmD students are eligible who are coming out from the recognized universities, which are approved by, once again, the Pharmacy Council of India. And intake is going to be 2 seats per batch. Once again, even they're having the 2 seats in the batch in oncology pharmacy. So eligibility criteria is same as JSS, where the PharmD graduates who are having aggregate marks of 60%, as well as who registered as a pharmacist in State Pharmacy Council, they're eligible to apply for this fellowship program in oncology. And I think the course what you are going to be studying slightly different from JSS to this SEC. And here, if you see, the first year is going to be, they're going to be study completely, once again, on oncotherapeutics and research, where they're going to have a complete 9 modules. They're going to be studying completely on the oncotherapeutics. The various treatment options are there for the cancer, and they're going to be study on that, as well as some of the new research is happening on the oncology area. So they're going to be study completely in the first year, and the second year is going to be the internship of 1 year completely in one of the SEC hospital. As we know that there are many branches of SEC in India, and the main one is in Bangalore. I think most of the times you are going to be get the training in the Bangalore itself, Bangalore SEC hospital, and here maybe the stipend you are going to be get only during the internship. You may not get the stipend in the first year, but you may get the stipend during the second year internship, where you are undergoing the internship in any one of the SEC hospitals. So that's about the second opportunity. Maybe if you are very interested to be pursue further your career in oncology, I think these two are the very good opportunities for you to become as a specialty clinical pharmacist by joining either in JSS or maybe associated with the SEC hospital for doing the residency. I think it may be the residency or fellowship, the terminology is changed, but otherwise what you're going to be get after PharmD is going to be the same. And the other opportunities, I was searching for other opportunities for PharmD, especially to pursue further and to become a clinical pharmacist. And there are various other opportunities. The only thing is, I think we are not searching. I think without searching, even before I search, also I was thinking there are no opportunities. But once I search for the opportunities, I felt that there are lots of opportunities even for the PharmD graduates. And if you see what I'm going to show here, maybe other people may feel bad. MPharm people may feel bad right now because they did not mention MPharm. They mentioned only the PharmD, the qualification. I think this one advertisement I was showing, I think even in my previous presentations, also I was showing this, even though the date got over, but I just want to show you that there are opportunities, right? So as you know, the Tata Memorial Center, and it's one of the important center for the cancer treatment, advanced center for treatment and research and education in cancer, which is there in Mumbai. And recently I have seen this 1 year fellowship in oncotherapeutics. So they're giving the fellowship in oncotherapeutics, and they mentioned that I think it is coming from the 1st September 2020. And the qualification, if you see, they mention either it's an MD pharmacology or it's a PharmD from the recognized university. So you should see that I think it's the PharmD, they mention almost equal to the MD pharmacology. It is not even equal to the MBBS. I think they did not give any MBBS here. The minimum qualification itself to get this oncotherapeutics is either MD pharmacology or PharmD. I think all the PharmD students should be proud for this. They should be very happy for this. At least they are recognized now in India, right? It is not like earlier situation. And one more important thing, if you see the remuneration you are going to be get for that 1 year period of time, it is not that you are simply learning. You are learning as well as you are gaining the money there. You are earning money there, and you're going to be get the remuneration. If you're an MD, they're going to be give 65,000 per month, and for PharmD, they're going to be give 53,000 rupees per month. I feel it's going to be more than your salary if you get any very good job maybe in a very good company, right, after PharmD. So like this, there are opportunities. The only thing is you need to try for it and you need to get it. So if once you get it, you're going to be a specialty pharmacist, right? So here, once again, if you gain this training, 1 year fellowship in oncotherapeutics, you can be a specialty, a pharmacy, a clinical pharmacist in oncology hospitals, right? And it is not only these organizations and which are apart from industry. I have seen that even in industries are coming out with now some kind of fellowships, and especially for PharmD fellowship. And it is not that no, they started now by seeing there is a PharmD in India. As you know, that PharmD is an established concept in US, and all these companies are there even in US. So they know what the PharmD students can do. That's the reason I started all these PharmD fellowships long back. So as a PharmD students from India, even you can gain these opportunities, and you can also get these fellowships and get better understanding even after your 6 years PharmD course. As you know, the BMS, I think the topmost pharmaceutical companies in the world, right? BMS, Bristol Myers Squibb, and in the website I have seen that there's a PharmD fellowship program. They're offering PharmD fellowship program, and they're offering, I think, in various areas. Like you can see that the medical information, medical strategy, research and development strategy, analytics, and global marketing. So it is not that PharmD fellowship means it is like only what I shown, like oncology, nephrology, those kind of things. You can get the fellowship even in industry, so you can understand what is happening in the industry as well. So you can do 1 year complete fellowship in the industry to gain the understanding in what all the things are happening in the industry. And also Dr. Reddy's. There's one more reputed organization, Dr. Reddy's Laboratories. They come out with this pharmaceutical industry fellowship program. And if you can see here, it's a very clear, they mention the general overview of fellowship, what they're going to be provided to these PharmD fellows. And they're going to be, fellowship is intended to provide a comprehensive multidisciplinary experience for PharmD graduates. And they focus the two important areas, maybe where the PharmD students will get training. The focus is going to be mainly on the two important areas, the pharmacovigilance and the medical affairs. I think pharmacovigilance, everyone knows about it. You can gain some understanding in the pharmacovigilance if you go and pursue this fellowship in Dr. Reddy's. And the medical affairs, if you did not hear the terminology, maybe you just note it down, especially the PharmD students, the medical affairs. Even recently, I got to know this about a particular area in most of the companies, the medical affairs, where currently they're taking only the MD or maybe the PhD candidates for this medical affairs. And where they are going to be, the medical affairs are going to be people who are going to be work for the company, and they're going to be give all the insights about that particular therapy internally as well as externally, right? So they're going to be connected with the people as well as to the researchers in the industry, and they're going to be give all the insights what going to be the future, right? Especially in terms of the pharmacotherapeutics. So they're going to be give all those advices to the people inside as well as outside the company. The medical affairs is a very important area. I think there is a process started. I was attending as a speaker in one of the global medical affairs conference recently, and there even I highlighted that why you are taking only MBBS or maybe MD pharmacology. Even currently, actually speaking, the scenario is something different in outside. Most of the medical affairs people are going to be the PharmD graduates in outside, like USA, UK, and all, because they're going to get good number of PharmD students there. The scenario is something different in India, where they're taking only currently the MBBS or MD students. As I mentioned them that even PharmD students are there in India, and we have a good number of students are coming out every year from reputed organizations. So you can try them, you can try for them, and maybe you can call for interview and then see the capability, what they can do. And maybe once you give some training, I'm sure that PharmD students are going to be do at most equal to the other graduates who are coming as a medical affairs team. So I mentioned that maybe soon you can get some opportunities even in this very good division in the companies, medical affairs. You can just have an eye on that. And when I searched for this, I got one more opportunity, Novo Nordisk, where they're offering once again 1 year medical affairs PharmD fellowship, right? So here the PharmD graduates opportunity to make the impact of areas, the areas like diabetes and the rare bleeding disorders, and the hormone levels, and the most importantly, the patients who are living with these illnesses every day. So they say that PharmD graduates inputs are very much required for all this. And that's the reason they're offering to give a 1 year medical affairs PharmD fellowship. So this is completely on the medical affairs. If you get this, I'm sure if you can get this opportunity, I'm sure I think you are going to be recruited by the renowned organizations, the companies, multinational companies, as a medical affairs team. So the initial position is going to be a medical science liaison is a position they're going to be give you, and that's going to be the, I think, one of the best job any PharmD students can get in industry, medical affairs. Okay, so if you pursue this, you can get that option, and maybe you can do further in this medical affairs very well. And there are many other companies. I'm just showing you a few examples. The Biogen, once again, it's a biotech company where they're offering the PharmD fellowships in different areas like the global safety, regulatory science, and worldwide medical affairs, as well as US medical and therapeutics development. So they're offering the PharmD fellowships in various areas. So if you can gain that opportunity, so then you're going to get a specialty pharmacist in any one of these areas. So those are the different opportunities we have in India as an Indian PharmD graduates. You can pursue further to become a specialty clinical pharmacist. And coming to the other countries briefly, maybe I can show you what are the other opportunities are there in other countries to become a specialty clinical pharmacist. And one important thing is, once again, the residency program. So the residency program in India started, especially in JSS started, it is based on the US model only. So that means in US, the concept is already established. Okay, residency program is already established, and many PharmD students are going to be opt for this residency after their graduation, and they can become the specialty clinical pharmacist. So the residency program, how it's going to be in USA, I'm going to just show you overall. I think maybe university, maybe something differences will be there. But overall, if you see the residency program after PharmD, once again is going to be have mainly for 2 years course it is. And the pharmacists who are interested in direct patient care roles can seek additional training by doing this. Here something, terminology is different. It's a PGY1 here. There's a postgraduate year 1 residency programs in acute care as well as ambulatory care settings. So you can get some additional training after doing PharmD. You can get some additional training to work in this acute care as well as ambulatory care settings as a clinical pharmacist by undergoing this PGY1, postgraduate year Y1. And the second year is going to be the postgraduate year 2, where you can get the specialization completely in one particular area. And for example, you can get a specialized training in ambulatory care or critical care, infectious diseases, or internal medicine, oncology, or many other branches are already available in USA to do the residency. And if you want to pursue this PGY2, certainly you need to undergo PGY1. And the scenario is something different from India. From India, especially in JSS, if you join for first year, certainly you need to complete both the years, right, together. But in the US, the scenario is not like that. Maybe you can do PGY1 in one university, and then you can discontinue after maybe because of some reasons, and then later you can join in any other university for PGY2. So there is a gap between PGY1, PGY2. Maybe you can do only PGY1, or after PGY1, you can also continue for the PGY2. So there are two options that are available. And if you want to become a specialty clinical pharmacist in USA, you have a residency program where you can undergo the PGY1 and PGY2. So the other information about residency program, you can get from this organization websites, the very important websites. Maybe you can get so much other information about residency programs. American College of Clinical Pharmacy, ACCP, a very important organization, and American Society of Health System Pharmacists, ASHP, American Society of Health System Pharmacists, one more important organization where you can get the information about residency program. And one more important organization is American Pharmacist Association, APHA. So these are the three important organizations which are available, which are existing in USA, where you can get lots of information about the residency program and specialty clinical pharmacist practice in USA. Right? So you can go through these websites and maybe you can get more understanding if you want to pursue further in USA after your PharmD in India. And one more aspect is, maybe if you are practicing in one particular area already, let us say you have joined in one of the hospital in India as a clinical pharmacist, and from the past 3 years or past 5 years you are working in one particular area. For example, you are working in emergency medicine, okay, and you got very good exposure in the emergency medicine in the past 5 years. And now what you can do is, if you want to have a name that you are a specialty a clinical pharmacist who are trained in the emergency area, and maybe you can be approved by one of the agency, right? That's a board of pharmacy specialties, BPS. It is one of the body within the American Pharmacist Association. So you can be a specialty pharmacist by the BPS. If you get some training in that one particular area, and you can write the examination of BPS, and you can be a certified a specialty pharmacist in that particular area. So what the BPS is going to be doing here is, licensed pharmacists are also encouraged to become a board certified once they have gained the adequate clinical experience. So it is not that immediately after joining clinical pharmacy, after joining as a clinical pharmacist in a hospital, you cannot go for this certification. You need to gain some experience. They did not say clearly how many years you need to have the experience, but they said you need to have in the overall training what you received in that particular area. So 50% of the time you need to spend for that particular area. So that's what they mentioned in that regulations. But maybe you can go and see the BPS regulations once again, because that's going to be different from specialty to specialty. So if you're already working maybe in one specialty, if you want to become a certified specialty pharmacist, you can go through the regulations and you can write the examination, and then you can be the certified specialty pharmacist. And it's going to be signifies that individual pharmacy specialist possess a body of knowledge and skills in addition to that of the general practitioner. So once they get this certification, they can get a very good knowledge as well as skills in that particular area. And currently, if you see, these are the 13 specialties are recognizing currently by the BPS. As I mentioned, there are various specialties where you can be a specialty clinical pharmacist, starting from ambulatory care pharmacy, cardiology pharmacy, and compounded sterile preparations, critical care pharmacist, where you can work in the ambulatory care and as well as in the emergency care, geriatric pharmacy, so you can work only for the geriatrics, infectious disease pharmacy, I think where you can work mainly for the antibiotics, nuclear pharmacy, nutrition support pharmacy, oncology pharmacy, a very important one, pediatric pharmacy, pharmacotherapy. The pharmacotherapy is a very renowned in in USA. So where most of these PharmD graduates will opt for this pharmacotherapy certification from BPS. And you can be a psychiatry pharmacist. And the last one is solid organ transplantation pharmacy. So like this, there are various 13 types of specialty pharmacies which are currently approving by the BPS. And if you're already working maybe in any one of these areas, and you can write the examination of this BPS, and you can be certified by the BPS as a specialty clinical pharmacist working in that particular area. And the certification examination for each of these specialties are offered annually. So every year they're offering this examination, and you can write that examination, and you can get certified from the BPS. And the length of the certification is for 7 years. So after every 7 years, you need to recertificate. And for that, maybe you need to write the examination once again, or maybe you can gain some credits which are given by the organizations in USA. You can gain some credits. So with that credits, maybe you can renew your certification. So it is not that easy. Actually, what I understood is it's one of the toughest examination to be passed to get this certification. And for that, once again, we need to pay even some dollars to write the examination. And every year also we need to pay some money to the BPS to continue your certification, right? So I think maybe those kind of information you can get in detail from this BPS website. But if you're interested to be a specialty clinical pharmacist, and if you want to be certified by BPS, you can go through this information further and you can write the examination. So similarly, there are residency programs which are available in all other countries. I'm not going to go through all the countries, but I'm showing you some of the important countries where you can get the residency program. In Australia, once again, the important organization SSPA, Society of Hospital Pharmacists of Australia, it is one of the important organizations in Australia, where they started this residency program, and where they're going to be given in 2 different areas, the foundational residencies, that's the initial stage, as well as the advanced training in the residencies. So after M.Pharm pharmacy practice, and if they want to become a specialty clinical pharmacist, so they can undergo this residency program by SHPA, and they can be the specialty clinical pharmacist. So under this advanced training programs, currently they're offering, these are the 4 important areas where they can get the specialty, like oncology and hematology, geriatric medicine, medicines information, as well as a critical care. So these are the 4 specialties currently they're offering to be as a specialty pharmacist. So the people can undergo any one of these to become a specialty pharmacist. So coming to the UK, I think UK as well, there is a London Health of Science Center. They're offering currently this residency program. And they have given the clear information. Maybe if you go through these guidelines, you can understand what exactly you're going to be do under this residency program. They have given the clear-cut information here in the regulations as well. What are all the things you are going to be do during the residency, starting from orientation you're going to be get, and inpatient drug distribution system you're going to be undergo the training, and the drug information, evidence-based medicine, and you're going to be undergo some of these specialty trainings like general pediatrics, or maybe the pediatrics ICU, hematology, neonatology, NSU, and the infectious disease antimicrobial stewardship program. You are going to be undergo for 3 weeks training, as well as in the general medicine. So like this, they're giving some residency programs even in the UK. And I did not get exactly what will be the qualification. I think maybe MS in clinical pharmacy, MSc in clinical pharmacy, maybe the eligibility criteria for this undergoing the residency program in UK. So there are lots of opportunities. I just searched, maybe for 2 days, I just searched and I got this information. And as an aspirant, maybe you can spend more time than me in front of system to get all these understandings. So if you search for it, certainly there'll be an opportunity. The only thing is you need to spend some time and search for the opportunities to gain a specialty knowledge in the clinical pharmacy area. So that's a brief presentation from my side, just to give you some understanding about specialty clinical pharmacist. That's going to be the future of pharmacy, maybe in India. And so that you can have some understanding in all this, so that you'll be well prepared. So thank you so much for giving me this opportunity. I thank everyone presented here patiently from a long time. So if you need any questions, maybe please mail to me so that I can try to respond as early as possible. Thank you so much, everyone.
Thank you, sir. This was a thoughtful session. We received a few questions from participants. Question 1, whether specialized practice during internship will enhance clinical research in India?
Sir, can you please repeat the question once again? I think I did not listen that.
Whether specialized practice during internship will enhance clinical research in India?
So whatever the specialty practice are getting the internship, no, sir, the main drawback for that, it's not drawback, but they're getting the training anyway. So they're going to get the training for a shorter period of time, like 2 months in each specialty. So that's not sufficient to say that they're the specialty clinical pharmacist in that particular area. So in that 2 months, they can gain some understanding in that area, but no, they cannot be a specialized pharmacist, particularly in that area. So for that reason, the specialty pharmacy practice is coming out, where they can undergo for complete 2 years in one particular specialty, so that they can be called as a specialty clinical pharmacist after gaining a skillful and knowledgeful 2 years course.
Okay, question number 2, why we need to pursue fellowship after PharmD?
So why, in the sense, I think maybe if you're interested, you can do that, because if you don't want to stop with the PharmD, and if you're of doing something different after PharmD, without maybe directly joining in any of the companies, or if your area of interest, maybe certainly maybe when you undergo internship, all of you may be liking one particular rotation. So I like this pediatric posting, right? And maybe if you want to pursue further in that area, these are the opportunities. So you can pursue the fellowship, you can get specialization in that particular area. So that is your area. In the future, you can say, this is my area where I'm working. So for that reason, maybe you can pursue that specialty.
Thank you so much for your informative speech, sir.
Thank you, sir. Thank you very much. Any other questions from audience?
No, sir. No, sir. Thank you.
Yeah. Thank you.
Thank you. Now we come to the end of the session. Now I invite Dr. M.G. Rajanandh, Assistant Professor, Department of Pharmacy Practice, to deliver vote of thanks.
Good afternoon.
Good afternoon, sir.
Yes, sir. Rajanandh.
Yes, sir. So good afternoon. My respect to all. Good afternoon. My respect to all. It's my pleasure to deliver the vote of thanks on behalf of the Department of Pharmacy Practice, Sri Ramachandra Faculty of Pharmacy, SRIHER. I express my sincere gratitude to Chancellor and Pro-Chancellor and other management officials to permit us in conducting this webinar. And my sincere thanks to Vice Chancellor, Professor P.V. Vijayaraghavan, Sri Ramachandra Institute of Higher Education and Research, Chennai, for delivering his presidential address and for spending his precious time in spite of his busy schedule. Thank you so much, sir. My special thanks to our principal, Professor Ciddi Veeresham, Sri Ramachandra Faculty of Pharmacy Principal, SRIHER, in delivering his welcome address and bringing two eminent speakers in the field. And we thank you, sir, for your constant support in each and every activity of our department. Now, I thank Dr. K.L.Senthilkumar, President, APTI Tamil Nadu Branch, and Principal, Sri Vijayaraghavan College of Pharmacy, Dharmapuri, in delivering his keynote address, and for being kind enough in accepting our invitation and associating with us to organize this event. And I express my sincere thanks to Dr. Adepu Ramesh, Principal cum Director, Vikas College of Pharmaceutical Science, Telangana, in delivering this talk on the session Next Generation Pharmacists. So your talk is excellent, and we all have learned much from you, sir. Thank you one much. Thank you so much for being our inspiration in the field. And my sincere thanks to Dr. Krishna Undela, Assistant Professor, Department of Pharmacy Practice, Naipur, Guwahati, in delivering the session on how to become a specialty clinical pharmacy practitioner and opportunities in India and abroad. Thank you, Dr. Krishna, in accepting our invitation and adjusting your date in spite of his busy schedule, and today for being with us. And on behalf of the Department of Pharmacy Practice, I express my sincere thanks to Vice Principal Dr. K. Chitra Madam and Additional Vice Principal Magadaya Madam and all our faculties, teaching and non-teaching staff of the Ramachandra Faculty of Pharmacy, and especially a special thanks to our Communication Department in bringing the webinar in smooth way. And not the least, I express my sincere thanks to all the participants for your listening and maintaining the dignity and decorum during the presentation. And thank you all for your patience listening. Thank you.
In addition, we thank to Dr. J. Sirikan, Assistant Professor, Department of Pharmacology. The webinar session will be ended. Thank you all.
Certification will be provided. Ramesh, Krishna, sir.